Hi, my name is Nicole Darren. I'm going to be doing my infant assessment on our patient here, Johnny, which is a 6-month-old infant. And so the first thing I'm going to be doing is foaming in and introducing myself to the family and to the patient. Check the ID band, make sure we have the correct patient before we begin our assessment. So then when if the patient is lying on their back, someone seems to be a little not cooperative today. So you're going to want to check the fontanelles. The front one, you should feel a suture line, but they should be soft and flat. And then on the posterior side by this age, they should be fused together, but they'll still be soft and flat. And then you're going to work your way down. So you're going to assess for perla, make sure that the pupils are equal, round, reactive to light, and accommodating. All right, there we go. Good. And you're going to want to inspect the ears, the skin. The skin seems to be warm, dry, and intact. You'll take the gown off for that to see underneath as well. And then we're gonna take the gown off and we're gonna listen to some heart sounds. So S1 and S2 is auscultated, regular rate and rhythm. Normal heart rate for this age would be about 100 beats per minute, and you're gonna listen for a full minute. And then you're gonna move on to lung sounds. And you're gonna listen posteriorly. And on inspiration and expiration, our patient's breath sounds are clear. There's no sternal retractions. There's no nasal flaring. Our patient seems to be calm while breathing. So that's a good sign. Respiratory rate is about 30 per minute, which is normal for this age. And like I said, no accessory muscle use, so he seems to be in good condition. Then we're going to move on to the abdomen. You're going to want to inspect the abdomen so it's flat and rounded a little bit. And then we're going to move on to auscultation. So you're going to want to listen until you hear some bowel sounds. So we've got bowel sounds in all 4 quadrants, which is great. And then we're going to be palpating. And you're checking to see if your infant winces, if it pulls its knees up to its chest, starts crying in any of these areas, which our patient is still very calm. So that's a good sign. Then you're going to want to move on to the peripheral pulses. So we're going to be checking radial pulses. They're both strong. Brachial pulses, also strong. The patient seems to like that. Then we're going to be checking pedal pulses, which are strong as well. You can check the groin as well. And in the meantime, you're going to take the diaper off, check the genitalia to see if our patient is a male, that the testes have descended, that there is no excoriation in the diaper. Everything looks healthy here within normal limits. You're going to want to check for urinary output as well since you're here, if there's anything in the diaper. And then you're going to be checking for cap refill, which is less than 3 seconds, which is beautiful. And then in the meantime, you're looking for developmental milestones. So if your patient can roll from back to front, if they can hold a bottle up, and it seems like our patient is doing very well. And then you'll grab vital signs as well. So for an axillary temperature, a normal would be 37.5 degrees Celsius, and a blood pressure as well. A normal would be about 75/40 for a blood pressure. You're going to check the weight also. 16 pounds is about a normal for a 6-month-old. Height 26 inches from head to heel, and then a head circumference of 48 centimeters, which is also normal for this age. And that concludes our general assessment.